The coronavirus pandemic made us all spend a lot more time thinking about our personal health and the health and wellness of loved ones and friends than usual. But our medical experts want to remind us all to go back to a regularly planned medical routine, including checking in with your doctor.
As we ask our citizens to start taking care of their diabetes, their heart disease, a lot of their mental health issues, I am sure a lot of us are wondering, what has changed now? Is it safe for me to go back to my healthcare provider? Am I not putting my health at risk? What about COVID-19? And all of us are here together today to reassure you and explain to you the extraordinary measures that have been put in place to make sure that when you visit your healthcare providers or when you come to our facilities, things are different now. And a lot of measures have been put in place to make sure that you and your loved ones will be safe when you come to visit us.
Dr. Assad, a panel of distinguished healthcare professionals and local officials, met recently in the Las Vegas Medical District, united together to urge an anxious populace that it is not risky to return to a regimen for your physical, medical, and dental requirements.
We feel that it's very important that now our community can get back to some normalcy, get back to their doctor's visits, their mental health visits, their autistic child's visits, get back to getting themselves comfortable, healthy, and ready for the fall, because we have worked tirelessly many hours. Our testing is phenomenal.
Clark County hospitals postponed all elective and non-emergency surgeries in March and April to safeguard the resources needed to treat patients with COVID-19. And at the early stages of the pandemic, these same health experts advised all non-essential workers to stay home. But times have changed.
In the 2 months that have since elapsed, a lot has changed. We have learned a lot more about this disease. We have learned how to prevent the spread of disease. As of May 29th, we have now entered phase 2 of reopening of this city and the state of Nevada. And I think the time has now come to allow our citizens to start taking care of a lot of those medical problems which for the last 2 months have been put on the back burner. We want our citizens to now start taking care of a lot of those medical problems which have so far been neglected.
The University Medical Center and every medical destination have transformed with a number of new practices, procedures, and supplies of sanitation product becoming the new normal for all visitors, patients, and healthcare professionals.
It also allowed us to look at all the recommendations out of the CDC, the Health District, the American College of Surgeons, the Nursing Association, the hospital associations, and we've all taken those proactive measures. We've been able to procure our supplies, our PPE, our ventilators, improved our negative pressure rooms throughout all of our facilities, deployed all the strict measures that Dr. Assad had mentioned. Again, if you come into a hospital or a provider's office today, you're getting a screening as far as temperature check, questions, being masked. You're seeing extensive cleaning, expanded sanitizing, and other proactive measures. Social distancing, we're doing those in our facilities with our own teams, our lobbies and waiting areas.
The old medical adage that an ounce of prevention is worth a pound of cure has never been truer. Vaccinations and other shots should not be ignored.
And now it's time really for people to start taking care of themselves. We've noticed nationally that there's been a decrease in hospital utilization for non-COVID events. And we worry about that because we know that heart disease is still out there. We know that people are still having strokes. We know that cancers and malignancies are still out there. So I want to encourage our citizenry to take care of themselves and to come and get their preventive health services. Part of that are vaccinations. You've heard talk about that. But vaccinations are absolutely critical to prevent infectious diseases. Nothing in the past 100 years has made that more apparent than the current COVID epidemic.
The Southern Nevada healthcare community is ready for us all to address our health concerns. Visit LasVegasMedicalDistrict.com and follow the links to Welcome Back, Your Doctor is Ready for You Now to learn more.